keeping families healthy.
So it's great to be with you guys again for the monthly master classes. We're going to learn, grow, elevate, and tonight, as I always have to do at every master class, put out the disclaimer that I'm not distributing medical advice. I'm not telling you to go on a medication, come off a medication. I'm not allowed to do that as a doctor of chiropractic. So hopefully that's everything I share with you tonight is construed as simply giving information, knowledge out to the community for informed consent. I'm not here, and I don't ever do the master classes to convince people of anything. It's simply to give you the knowledge, informed consent, so you can make the best choices and decisions that you feel right is for your life and your health. Fair enough? That's all the master classes are about, right? What you do with the knowledge, it's up to you. That's a personal choice. But I feel compelled and obligated to at least arm my patients with knowledge and truth backed up by cited medical information. So we're going to jump in, and a lot of you guys have seen this slide before, but we know one thing: over the last couple of decades, everything is really moving in medicine. This is why a lot of medical doctors I know have gotten out of Western medicine, out of that system. It's because everything is cookie cutter. You walk through the door, your cholesterol, total cholesterol is over 200, you're getting a cholesterol medication. It's standard. Whether you like it or not, it's going to be prescribed to you. Same thing with blood pressure. It's all cookie cutter. And what people really want, and what most doctors are moving toward today, is personalization, customization. It's how we really strive to care for patients in this office. As the years have gone on, certainly over the last 5 years, the problem with heart disease being the top killer has gotten better or worse? What do you think? It's gotten a lot worse. In fact, the numbers of deaths in cardiovascular disease and all of the statistics that go with it have gone up by 10% in just the last 4 years. So we know there's a major issue, and really the biggest issue is that our community doesn't have the knowledge, the information they need to make the best decisions, or at least have intelligent conversations with their doctors, their cardiologists, their internists, their PCPs. They don't have the knowledge. And if you don't have the knowledge and you don't have a way to integrate it lifestyle-wise and have maybe some accountability and following up and action steps, then how are you ever going to move in the right direction? And that's the key. And that's why a lot of medical doctors who we know, patients in here, have left that system because they've gotten frustrated. Doing the same thing over, every person who walks through their door gets the same thing. I went to a medical visit with my father-in-law over the last 2 years, several visits, and I sit in the room. Before the doctors come in, I go with my in-laws, and I sit there and I tell them, I go, here's what's going to happen. And to a T, it's exactly what happens. I go, before they walk in the room, they know what they're going to do. I go, here's what you're going to get. My father-in-law hadn't gone to seen a medical doctor in like 40, 45 years. He's 75. And they were going after him with letters and Medicare and all that. He's like, all right, I'll go. And so he went in. I go, here's what's going to happen. And he's healthy as a horse and been getting adjusted by me for over 20 years and just real healthy, old farm boy, strong body, strong mind. And I go, here's what you're going to get. And they're going to do it before they even have a conversation with you. You're going to get a statin, blood pressure medication, metformin, and aspirin, and they're going to tell you to fill it on the way home. And that's what he got. That's cookie cutter. They don't know anything about him. They don't, and I said, and whatever you do, make sure you fill it. Because if you don't fill it, what's going to happen? They're tracking you. They're tracking you on the way home, and they're going to call, and then they're going to report you to Medicare as a non-compliant patient. It's just a really bad system that the doctors are caught in as well. So what you have here is the most, and again, there's a lot of copy, and I put a lot on the slides here. I get it. Sometimes it can be a little overwhelming. Just get the concepts as I'm going through the information. The main reason I put so much on here is simply because I want you to build a library online on our website or all the slides from all the master classes, all the videos. So if you ever want to go back, reference, or pull something off and bring it with you to a doctor's visit, you have it. That's why I put so much in here. But while I'm speaking tonight, I just want you to get the concepts. Just grab hold of just the general theme. And the general theme of this slide, with all the stuff on it, are the side effects of the medications. So you have, for example, like the atenolol and the metoprolol, these medications, beta blockers, which shut down the sympathetic side of the body. They basically relax the body, block adrenaline so the heart slows down, But when you do that, you get tired, you get weak. It leads to a lot of different types of symptoms. Diuretics go along with these medications as well. And what does a diuretic do? It flushes out water, it flushes out minerals, magnesium, potassium, these things that are essential to normal body and brain function for you to feel good, especially magnesium. You want a healthy heart, you need a lot of magnesium. Now you're flushing it out of the body. So does anybody here know what the number one cause of death over the age of 70 is currently, especially in the state of Florida? What is it? It's not, I'll give you a hint, it's not heart disease or cancer. It's falls. And a lot of times, like the hip or the bone will break and then the fall happens. So, and other times, the person falls and they have the fracture. But many times things are breaking before they go down. So again, what do you have? The leading side effects of these medications are in red. Dizziness, lightheadedness, nausea, anemia. That's going to put you down. Your red blood cells are non-functional or malfunctioning and you're not able to carry oxygen. So you're going to get lightheaded. Low blood pressure, that's going to put you down. Depleting minerals and dizziness. You guys see how there could be a problem? Now you fall and you break a hip. You fall and you smash your head on the tile. The doctor's never going to say, oh, you know what? I think it's the blood pressure medication that did it. Or the 2 or 3 that I gave you that did it. They're never going to do that. And a lot of the reason why is because they're really not the bad actor in the whole deal. They went to medical school to help people. They don't really know, and they're not necessarily getting fed the right information. They're getting their knowledge from who and where? From the pharmaceutical rep who got the information and the brochures from the pharmaceutical company who does their own research and then publishes it in the British Medical Journal, the New England Journal of Medicine, the Lancet. They put their own stuff out there. So again, I just want you guys to see that the theme of this of tonight is not to say blood pressure medications are not life-saving. They are, absolutely. If you have an out-of-control blood pressure, you know, a 210 over a 140, you're lightheaded, you're not feeling your chest pounding, you may need a medication short-term to get that under control. Does that make sense? So we're trying to have a sane conversation revolving around medications. But the question to ask is, what type of quality of life do I want to have long-term? You guys with me? That's the point of it all, is thinking, okay, medications, they're sometimes necessary, but long-term, look at all of the problems that they could be causing in the body. You could shut down your kidneys. You could cause 15 other problems, and you go to the doctor with those 15 other problems, and what are they going to do for those 15 other problems? What are they going to do? More meds to treat those. Now the blood pressure medication injured the kidneys. Now the kidneys can't deal with the blood sugar. Now you're a diabetic. Now they put you on metformin, and it goes on and on. So again, there's got to be a better way, because the heart disease problem is only getting worse. And the main reason is because of lack of lifestyle information, the ability to help patients integrate that in their lives, and really getting to the cause of the problem. You could take these medications, by the way, and the main reason people take it long term, the main reason is why? They don't want to die. Right? I mean, I don't know about you, I don't want to die. Like, we don't want to die, right? That's why people go on these medications, even if they know there are bad side effects. But guess what? What you'll see as we go on tonight is they really don't extend your life. The cholesterol medications, the blood pressure medications, just as many people today sitting in the hospital, the number is somewhere between 50 and 75% of the people sitting in the hospital had a heart attack or stroke today, they have blood pressure and cholesterol in a normal range. Now, how did that happen? Because the cause of the blood pressure being high, the cause of the cholesterol, whatever it may have been, that was never addressed. So they still had a life-threatening issue happen, or they died. So you're going to learn as we go along that these things really are not as life-saving as we maybe have all believed at some point. So dangerous medication side effects, again, Coumadin. There are other blood thinners. Many of you guys are familiar with those. There's a lot of them out there. But Coumadin is the most common one. And again, if you've had a heart surgery, you've just had a major procedure done, you may need a blood thinner. You may need Eliquis. That may be a really good thing to take if you're coming off a surgery, if you're coming off some significant cardiovascular event, so in case you have clots or an embolus or something serious, deep vein thrombosis. But long term, the point is the longer you take these things, the more significant damage they do to the body. It rips calcium out of your bones and dumps into the coronary arteries, thereby accelerating hardening and blocking the arteries, osteoporosis, bone loss, fractures, and possibly resulting in joint replacements. So again, you can't rob from Peter to pay Paul, at least for very long. At some point, you can't trick the body. You can't trick the innate wisdom of the body. It's going to develop a plan B. Coumadin inhibits vitamin K-dependent proteins that protect arteries from calcification. This can potentially contribute to hardening of the arteries. Here's another one. Carol sent me an article earlier, and I've been talking about this since 2019. The American College of Cardiology, the American Heart Association in 2019 all came out with the statement, don't take an aspirin a day anymore. Guess what your doctors kept telling you? Do what? Keep taking an aspirin every day. My dad just turned 84. I told him 15 years ago, I said, stop doing, why are you doing an aspirin a day? He said, I don't know, a doctor told me to do it. He was doing it for decades. I go, stop doing it. I go, here's the research. And he stopped doing it, thankfully. And the main reason they said stop doing it is because for primary prevention, without having had a former cardiovascular issue or event, it's completely worthless, and worse than that, it causes bleeding, brain bleeding and GI bleeding. It's a really bad idea. And this is what the authorities said, don't do it anymore. Don't use aspirin. So why is your doctor keeping you on aspirin decade after decade after decade? But yet, everybody in this community thinks that that's what you're supposed to do. And that's why I need you to commission with us to get more people sitting in this chair. Some of you guys did a video earlier. We asked you to do a 30-second video. We're going to put it out there for you guys telling the story, telling others in the community that they need to have their butts here learning this information. They need to come and learn. And no, I'm not going to live stream it on Facebook. I'm not going to have Mark Zuckerberg own my stuff and shut me down and say you're violating our policies. This is my information. I've spent almost 30 years putting it together. We need to educate the community, but they need to be here. And I need your help. I'm just one voice. Commissioning means bringing people with you. And I thank many of you guys who keep doing that. Many of you guys are here tonight. You brought people with you. Thank you. Keep doing that. Keep getting the message out there. So the FDA has concluded that the data do not support the use of aspirin as a preventive medication by people who have not had a heart attack, stroke, or cardiovascular problem. If you have, then it's maybe good as a thinner for short term, not long term. Causes brain bleeding, causes GI problems. In such people, the benefit has not been established, but risks such as dangerous brain bleeding, stomach, are still present. Stay away from it. Biological facts in the great cholesterol con. Again, the only reason why we still have this major #1 killer in our country is people don't have the right knowledge. They don't have the right information. They don't know how this stuff is put out or why it's continued to be perpetuated. And newsflash, your medical doctor does not have time to do this research. I do a ton of it. I mean, I do it till my brain hurts because I want you guys to have what you need to make the best decisions regarding your health and move in the best direction. The medical doctors are not doing it. Almost all of them, unless they're kind of a freakish kind of doctor, almost all of them just wait for the pharmaceutical rep to come through their door. That's how they're learning about their information, including the COVID shot. They were learning that from the makers of the COVID shot. The worst thing that ever happened to this country's health was over the last 3 years. How the government and the media lied to all of you who took the shot and killed many of my patients. Why do I do these master classes? Because you are important to me. I want to protect you guys, and the way I do that primarily is with knowledge. So, same thing, cholesterol, the scam. Diet and exercise contribute only about 10 to 20%. Your body makes almost all the cholesterol. Your liver makes almost all of the cholesterol. Stores in your gallbladder or in the liver. The brain only holds 2% of the body's mass, but contains how much? 25% of the total cholesterol. So does our brain need cholesterol? Do you want to lower your cholesterol? Your brain needs it. The #1 side effect of taking a cholesterol statin medication, I can tell you this as a clinician for 30 years, is memory loss. People are complaining about their memory. I've talked to some of you guys in here about that, where your family members have come off it, and you're like, wow, there was a big change in their memory. I've seen it multiple times. So cholesterol in the brain serves as a powerful antioxidant, anti-inflammatory. It's anti-aging, anti-cancer. Neurons rely on delivery of cholesterol from the bloodstream by way of bad cholesterol. That's what medicine calls it, so they can treat it. So you can get scared. I got bad cholesterol, high, and then they can give you a medication. What that is a protein that carries life-giving cholesterol from the liver away. They call it bad because it's carrying it into the body, into the brain. HDL, good cholesterol, carrying it away from the body into the liver to get kicked out of the body. That's why it's called good. But it's not bad. It's good. You think your body made a mistake? How can something, it's not bad or good, it is. It's what your body does. But they call it that for a certain reason. Fundamental role of LDL, it's not cholesterol, it's a protein that carries cholesterol in the brain to transport life-giving cholesterol to the neuron, where it performs critically important functions. What does that last part say? If you can't read it, your eyes need more cholesterol. What happens to these benefits as a result of lowering your cholesterol? You're going to be in trouble. Yeah, and I'm going to show you exactly why you're going to be in trouble. Because, again, the body makes most of the cholesterol in the unit a day, especially in the liver. So what does a statin medication do? We're going to go ahead and dive right into the liver here. And here's what's going on. You have a statin medication that comes in. You take a statin medication. There are a lot of different types of statin medications. Statin medications are cholesterol-lowering medications. What they're designed to do is cut off this enzyme. HMG-CoA reductase comes along here. Statin stops it. It shuts down the function of your liver from making cholesterol. Good or bad? Yeah, you have a dysfunctional liver now. So by definition, you now have created liver dis-ease. Now, what happens is this. This right here, that enzyme, is needed to bring it this way. What happens is this whole flow of all these things that are made cholesterol, cholesterol bile acids for digesting fat, you're cutting that off. Now you're going to have a GI problem. Now your whole entire GI tract is going to be messed up. Now what happens is this. You cut off the production of cholesterol. Cholesterol is needed to make bile acids for digestion, vitamin D, sex hormones, cell membranes. You need cholesterol for a lot of things. But now you've shut that down or severely limited the production of cholesterol. Now what you have here, steroid hormones, membrane stability, prenylated proteins. Those are proteins that allow cells to talk with one another. The cells that really need to talk with one another are your immune cells. So when you're on a statin, you seriously suppress your immune system. That's what this is, prenylated proteins. They signal, it's how cells in the body communicate with each other. Is that an important thing? Cells communicating with each other? For sure. So now this right here, dolichols, that's needed to signal to the cells to make proteins and for cellular growth and health. If that's cut off or skewed, you have mutations of the cells. You have genetic mutations of the cells. And what is that also known as? That's known as cancer. So this is not my picture here. This is right from the pharmaceutical textbooks, the biochemical textbooks. This is what happens, the biochemical procession, when you take a statin, any statin. They're all designed, including red yeast rice. Does the same thing, just to a lesser degree. Natural. Many of your healthcare natural people have you on that garbage. Because it does the same exact thing. It monkeys with your liver. Just like a drug. Has the same exact lovastatin, same exact effect as lovastatin medication. That's how they developed it out of the red yeast rice. Still also not a good idea. Ubiquinol, CoQ10. Have you guys ever heard of CoQ10? It's the diesel fuel for the mitochondria to produce energy, and the heart needs a huge amount of it. You can get it in organ meats, heart, liver, red meat. You need a lot of CoQ10, a lot of it. And so what does that do? It cuts off the production pathway for CoQ10. Energy goes down, the cells don't work properly. You get old and tired really fast when you take statins long term. So you guys can see what's going on here. So now you've taken a drug, lopped the head off of this thing, but now all your numbers, your cholesterol, your total cholesterol, is exactly where your doctor wants it to be. That's good, yeah, right? They high-fived you, you're good. Again, I'm not talking about short-term, acute, emergency situation, whatever you need to do there, you do there. I'm talking about long-term. What is your health vision? Where do you want to land 5, 10, 15, 20 years from now? So the thing that they don't factor in when they do this research, they don't factor in, for example, you take a senior citizen, not you guys, but a senior citizen living in the state of Florida is taking an average of 13 medications per day. So when they do these drug studies, they don't factor that in. They also, in the drug studies, you should know, they do preliminary studies where they have their groups, they run their study on the drug on these people, and then what they do, once it's over, it's a randomization selection process, and they get rid of all the people who didn't do well on the medication. And they hand select the people, for example, who pretty much have perfect health, perfect body, perfect biochemistry. They're taking no medications, perfect body mass index. They don't drink, they don't smoke, no comorbidities. Certain races and genetics respond very badly to medications. They get them out of the picture, and they get like an ideal cohort to test that medication on. So there's so much not being factored in here. And so when you get down here at the bottom, what you're seeing here are basically all the things that go wrong. You take a cholesterol medication because it messes up the cells and the communication, you end up with diabetes. So the major side effects, fiber damage and atrophy, one of the top side effects, deep bone and muscle pain, rhabdomyolysis and rhabdomyolysis. Your body aches when you're on these. And when patients of mine go back to their doctor and say, are these side effects possible? Does this? Nah, they're rare. Or at least I've never heard of them. You say that to your doctor, I'm having this, my memory, this is going, they're like, I've never seen that before. That is code for, I don't want to tell you the truth. I'm lying to you. That's what they all do. No, I've never seen that before. I know, you're a freak. Never seen that happen. Patient tells me something in the room, or Dr. Leif, that I have never seen before. I'm like, maybe I should listen. Maybe I should listen. Tell me about what's going on, because this is important. If we're trying to get you well, I need to hear what your body's doing. So I don't care if no one's ever had this before. Let me know what's going on. Not medicine. No. These things don't happen. Ever since I went on the statin medication you gave me, or the 3, I just can't cognate. I can't put words together and thoughts, and I can't remember things. Does that happen? No, I've never seen that before. No, that doesn't happen. The heart, people have more heart attacks because it depletes the body of CoQ10 and magnesium and all these other things, especially if they're on a blood pressure medication with the cholesterol medication. So now you have diabetes, kidney damage, liver damage. The drugs that you are taking get shot out of your body quicker because the metabolism is all messed up. So even if the drug could work and help you, now it's getting flushed out of the body faster. You have decreased serotonin for normal mental well-being. Serotonin is for sleep quality, appetite control, mood, weight management. There's a lot of things that serotonin, sense of well-being. Statins shut that down, that pathway as well. How do you like them apples? And yet, 45% of all 45-year-olds in our community are taking a statin medication. 70% of all men over the age of 70 are taking a statin medication in our community. Why? Why are they doing that? Because they don't have the life-giving knowledge that we all need to make better choices and decisions. Everybody just goes with the tide. They just flow with it. That's it. Whatever their doctor tells them. Don't listen to that crazy quack chiropractor. They don't know what they're talking about. It's okay. My feelings don't get hurt anymore after almost 30 years. That's all right. I know I stand for truth and I walk in truth and I speak the truth. You can't hurt me with that anymore. Bring your cardiologist, have them sit here. Bring your PCP, have them sit here. Bring your internist, have them sit here. And they will not be able to challenge one thing that's being said up here. I guarantee you that. They know this is the truth. And so all of this stuff, fiber damage, pancreatic damage, diabetic. So here you go. Statins indirectly inhibit production of vitamin K2, keeps the bone calcium in the bones. So you take it, K2 protects your arteries from calcification. So when you're taking a statin, calcium would either go to the bone or the arteries. Brittle bones, calcified arteries. Healthy bones, healthy arteries. They don't tell you that because it doesn't matter. If you develop osteoporosis, not my fault. MD just gave you the drug. They're not liable. They're not liable for causing osteoporosis or you falling or breaking a hip or breaking a bone. They're not liable for that. Diabetes, recent study shows that statins triple your risk of type 2 diabetes when taken for greater than 2 years. The Jupiter study that I'm going to show you, the largest cholesterol medication study done by the drug companies, they cut it off at 1.9 years because they found there was a 27% increase of diabetes occurrence with people taking the rosuvastatin, the Crestor. So we know, and you guys just saw the pathway, why that happens. 2012, FDA adds warning, black box warning, that statins may increase A1C and glucose levels leading to diabetes. It's not my opinion, not my propaganda. I'm giving it to you right from the textbooks, right from the medical research. Can't be challenged because this is their data. I'm going to go through this stuff really, really fast, but it's reference material for you. More firepower if you need it. If you're having a conversation with a doctor, they're pressing you to take something. Here's another one. This is from the Journal of Nuclear Medicine, atorvastatin, simvastatin, fluvastatin. These medications are associated with long-term cerebral, metabolic, and cognitive what? Decline. Statin users, 300% the dementia risk of non-users. 3 times. Journal of Pharmacovigilance. What this was, Parkinson's disease. People with the lowest LDL cholesterol, bad cholesterol, everybody's trying to get their LDL down, not a good idea, were at increased risk for Parkinson's disease by what? Yeah, it's not my information, theirs. So this is another one, American Heart Association. Reports of cognitive impairment with statins. So bring that to your doctor if they refute it. This is from the American Heart Association, your journal. And just be prepared to be thrown out of their office. But non-serious reversible forgetfulness, confusion, and other forms of cognitive impairment. February 2019. So this was actually shown with people, elderly people, statins and cognitive impairment. These were people who had dementia. And what they did is they took them off the medication, the statin drug. Their memory started improving, the cognition started improving. And then for some reason or another, I don't know how, they got away with it. They put them back on it, and like all their bad problems, their memory problems, their cognition issues came back. And so it just shows you the power of that. Cognition improved with discontinuation of statins and worsened with rechallenge or reintroduction. And again, I just have it all here for you if you want to see it in terms of everything I just mentioned, not just the biomedical pathways, the biochemical pathways, but then also in the research journals. So you guys have everything you need for you not only to make great, smart decisions, but to make them with or without your medical doctor. Make sense? Increased risk of diabetes. Diabetologic, this is a 2015 major journal. Scientific reports. They increase tendonitis, swelling, inflammation of your tendons, of your joints, of your muscles. Goes on and on. Deterioration of bone quality. Colorectal cancer. All American Journal of Cardiology, just so you have them, you just know these come from substantiated medical journals. ED, kidney disease, joint problems, joint disease, injuries, more prone to injuries, feeling old, your body feeling old. Go back to your doctor, you have any of these, what are they going to say? I got ED. You think that could be from the medication? From the medication, are you kidding me? The statin drug? No, where did you get that from? Oh, you were on the internet. Dr. Google. Don't ever go there. That's stupid. Right? They shun. Right? Okay, and then when you walk out of their office, you know where they go? They go back to their computer because they don't know any of the stuff either. They go there like, where did they get that from? Where did they get that piece of paper they gave me? Oh, okay, and then they look it up. They do Dr. Google too. You see? It's not stupid. There's nothing wrong with doing your own research, right? Making your own mind up, right? Gathering up data, which is what you're doing tonight. Who here's ever heard of ALS? Horrific, rapidly progressing neurological disease. Awful. Lou Gehrig's. Most people I've seen with it, they're gone 5 years. Maximum. It's awful. Progressive degeneration of the nervous system, of neurology. They're linking this system right here, this review, to statins. But again, it all adds up when you look at those biochemical pathways and you look all the way upstream as when you lop the head off that HMG-CoA reductase, you're going to have a Valdez exon level oil spill down low. Does that make sense? Downstream. That's the problem. You have to, when you take a drug, if you feel it's right for you, you just have to take into consideration all the downstream effects. And sometimes in acute emergency situations, they're needed, right? Would you guys agree? They are. There's no doubt. But that's 1% category of medicine. The other 99% is the long term. What is it doing to my body? That's the thought process. And do I have to get to the cause of this problem? How can I do it lifestyle-based? How can I integrate strategies that are going to build me up and not break me down? Does that make sense? I mean, do I sound like a crazy person or? Thank you. No, okay. The largest statin, sometimes I do to myself. I do a lot of yelling. The largest statin survey in the USA, conducted in 2012, revealed that 62% of those who stopped taking the drug within a year said it was because of the side effects. Most side effects are reversible within a few weeks of stopping the drug or significantly reducing the dose. So some patients, they come in and they feel horrible. They want to get off all their medications, like their blood pressure and all. I'm like, don't do that. Don't do that. Talk to your doctor. Help them, get their help weaning off the med if they're willing to do that for you, especially blood pressure medications. You don't want to go cold turkey on those. You want to go them really, really slowly. Some patients say to me, you know what, I'm not going back to my medical doctor. I'm sick of that. I'm just going to do it. And many times I can maybe say, hey, you know what, this patient did it this way. That's how they weaned off the medication. I can't give you direct medical advice, but I can tell you what I've seen in my 30 years. I don't know. That's how I communicate it. Okay? I have to be careful. But the cholesterol medications, from what I've researched and what I've seen other patients do, the moment you flush those down the toilet, you're healthier. That's second. There's no weaning. Your body does not, many drugs become a surrogate for the normal function. You take a blood pressure medication, your body's relying on that. You can't just pull the plug. Same thing with psychotropic medications. You can't just rip it out and throw it away in one day. There is a weaning process. Not with cholesterol medications. You're going to feel better right away. Lipitor, atorvastatin, is, if you can see it, read it with me, is a prescription drug used with diet to lower cholesterol. Lipitor is not for everyone, just in case you were wondering at this point, including those with liver disease. Now, if you take a statin medication and it chokes off enzymes in your liver, what do you now have? You have a liver problem. You have liver dysfunction, or you could call it disease. Women who are nursing, pregnant, or may become pregnant. What does that say? That's exactly the reason why your doctor puts you on it and why you want the drug. Many people want it. Many people beg for it. Especially because of the fact that they've seen heart attacks, strokes in their own families. I've seen it too. People drop dead. It's scary if you have a family history. But really what it comes down to, genetics playing a very small part of it. Only about 1% of heart problems are congenital, where you have a serious physical defect of your heart, or a serious electrical conduction problem with your heart, or valves that never closed up. That's maybe 1%, maximum 5-6% of cardiology visits. The rest can be controlled or reversed through lifestyle. And that is a known fact. Same thing here, Crestor, rosuvastatin, is prescribed along with diet for lowering high cholesterol and has what, guys? Has not been determined to heart disease, heart attacks, or strokes. Crestor is not for everyone. I have patients after coming to the master class, they're still taking these meds. What did I tell you in the beginning? Tonight's all about informed consent. As long as you know and you're equipped with the information. I'm not here to convince anybody of anything. I just want to get you the information, expose you to it. And some people may be like, whoa, I'm glad I learned that. I'm glad I saw that. I'm glad I understood it. But I'm going to make my own decisions regarding my health. I'm just here for the information. That's fine. That's okay. I got plenty of people, patients who I take care of, who still take the meds, who go for the shots, what have you. After the master classes, it's none of my business. My business is to get your spine and nerve system healthy after the master classes are over. But we know this, $1 trillion of this medication sold. Number one leading top selling medication of all time. The Ozempic and Wegovy are getting really close to passing these medications, really close, but you know there's a problem. Again, so they don't guarantee that you're going to live. You're going to live longer, really confer any life. What this is, Dr. Jarvik, this is the study. This is the ad that's put out. This is statistical manipulation, marketing, smoke and mirrors. What they do is the drug companies legally create their own math. It's called drug math. And what they do is there's absolute risk and there's relative risk. And this is used in a lot of industries, by the way, not just in pharmaceutical research and publishing. So absolute risk and relative risk, or relative benefit absolute benefit, they're two very different mathematical things, because it takes at least 10 years and about $500 to $600 billion to bring a drug to market. And they're doing the research to submit to the FDA. So they control it. They control the math. They control the way the statisticians put it all together. And they're allowed to legally to use relative benefit versus absolute benefit. So what does that mean? Very simply, you have a group of 100 people over here, 100 people over here. This group over here gets the Crestor. This group doesn't. They track them for a year or two, and they see who has the heart attacks. So this group over here who took the drug, 2 people had a heart attack. This group over here, the placebo sugar pill, 3 people had it. 3 people had a heart attack or whatever cardiovascular incident. Okay, so the difference there, and I think we could all figure this out, the difference between 3 and 2 is what? 1. It was a 1% absolute benefit. And the way that draws out is about 4 days of extra life for like the general population, if you give it out. So what they don't tell you is that when they publish it under relative benefit. And they say, okay, somehow or another, out of that fraction that we got, now we have 36% relative benefit, right? And that's how they market the drug. And that's how they market all drugs. And that's how they market your vaccines. And that's how they're fooling, and they fooled most of America. So I'm not telling you guys anything you don't know, but this is how it happens. $1 trillion in sales. And the worst part about it is all the side effects that come from the medications. So, okay, it confers another 4 days of life, another 8 days of life, another 12 days of life. Maybe it confers another year on your life, whatever the number they want to use. But now you cut off the medical pathways, the biochemical pathways. Now all that time's being taken back. And now you live 5 years less because of all the side effects from the medications. Are you guys getting the picture here? Okay, so here's another one. And again, there's all, I put it all on there, so, if you ever wanted to, you can print it out and bring it to your cardiologist. High blood pressure, biggest myths in cardiology. You can't control your blood pressure naturally. I see this, and I don't know if I've ever seen any different. Clinically, a patient loses 20, 25 pounds. They don't care about their blood pressure. They just want to get leaner. And they come in, they're like, oh, by the way, when I'm sitting with them, by the way, my blood pressure dropped 20 points systolic, 20 points diastolic. Like almost 100% of the time. Someone loses 20, 25 pounds, even less than that, the blood pressure comes down, right? Would you guys agree that that's kind of a normal thing? And so if you bring that up, they're going to say, no, this is bad genetics, bad luck. You're missing pharmaceuticals in your body that you should have been born with, pharmaceutical deficiency. So what is normal blood pressure? I had a patient about 6 months ago. She's getting close to 60, and she got off the table after getting adjusted. She said, my cardiologist said I need to get these blood pressure medications into my body because my blood pressure is it runs about like 134, 137 over 90, and he's scaring me. And she said to me, shouldn't your blood pressure go up a little bit as you age? Like, don't your arteries get a little more rigid as you age? I don't care who you are, how good a shape you're in, including me in this discussion. Like, our arteries will never be as supple as they were when we were 15. So to say that, again, one size fits all, the whole community should be 120 over 80. The whole community should be total cholesterol 200 or under. Does that make any sense at all? So again, we have to understand, like, what is normal blood pressure? And by the way, the Mayo Clinic, just a handful of years ago, they said under 160 over 90, under that, any medication, heart medication, does very little, if nothing, to stop you from having a heart attack or dying from a heart attack. That's a scary blood pressure reading for a lot of people. But unless you have, like, you're passing out or your heart's racing, you feel lightheaded, dizzy, it's not a problem. Our arteries get more stiff as we age. Now, bad lifestyle can make it much, much worse. But again, we have to understand what is normal blood pressure. Take a garden hose to understand the systolic and diastolic. If you turn on the big hose and you fill up the garden hose, that pressure in the hose is as the water's filling up, that's the systolic, as the heart's pumping into the arteries. It expands. the tension or the pressure. You turn off the hose, that pressure that comes back, or as the water's leaving and the pressure comes, or the hose goes back to normal, that snapback, that's the diastolic, the resting pressure. And that's all it is. And so again, there are plenty of people who have much higher blood pressure than 120/80, and they're perfectly fine. Yet if they take the medication, guess what they're now going to have? Now they're probably going to have a kidney problem, they're going to have a heart problem, they're going to have other organ problems, which is going to force their blood pressure to go even higher to accommodate maybe for a sluggish kidney or sluggish kidneys or whatever the case may be. But again, 1% require medical intervention, a surgery, like a bona fide heart problem that absolutely needs a medication or some kind of medical intervention, but usually not the case. It can be controlled by lifestyle. Don't let this confuse you. I'll tell you what it means. You'll get the concept. This study right here from journal Hypertension, Cardiovascular, this is released by the American Heart Association, so you know it's got to be true. The people with the highest risk had normal blood pressure while on pharmaceuticals, or a blood pressure medication, or multiple blood pressure medications. You guys can fact check all this stuff. Don't care. You guys will see it. So that green right there is people who got fit into the doctor where the doctor wanted you, got you like 115, or worse than that, like 102 over 62, and they're high-fiving you in the office, and you walk to your car and you collapse from low blood pressure. But they're happy. They documented what they did was right. But here you go. You're seeing right here. The people, this is follow-up over years, the percent risk of having a cardiovascular event going up, they had the highest risk. People that took the meds pushed into a range. Why? You guys tell me. I want you to think about this for a moment. Why would they have the highest risk for a cardiovascular event? Why? Hadn't taken care of the cause. You see? You're manipulating one side of the body, but there's also an innate wisdom and intelligence over here, right? So the whole concept of tonight is not drugs bad, don't ever do them. That's not what I'm saying. What I'm saying is understanding how the body's supposed to work. When you take a drug, the interference you can create, and if you stay on it long term, the imbalances that can be created and the significantly larger amount of issues that can take place. Does that make sense? I want you to have this knowledge for a lot of reasons. One of which, if you're taking the meds and they're causing all these problems in your body, and you're coming here month after month, year after year, complaining about these problems, to me, and I know they're the medications, it's painful to see that. I want everybody in this room, including my own patients, to reach their God-given health potential, to reach their best. And I know this is a major interference to that process. The American Heart Association, I talked about this earlier. The American College of Cardiology and the American Heart Association all said that in 2019. Stop it. If you've not had cardiovascular disease, it's much more important to optimize lifestyle habits and control blood pressure and cholesterol as opposed to recommending aspirin. 99% of the cardiologists in this community every day are recommending a daily aspirin for primary prevention. This is a big study. I could have put another 20 studies like this up here. I just wanted to show one. Lifestyle, getting to cause. That's what we mean when we get to cause. Lifestyle, feeding and nurturing and nourishing your body with healthy diet, movement, limiting alcohol, not eliminating it, but reducing it, not smoking, sufficient sleep. That's important, yes? So all of these things, this study, 1994 to 1997, large cohort, very large, 65% lower risk of cardiovascular disease, and an 83% lower risk of fatal cardiovascular event, disease, stroke, heart attack, dying. There's no drug out there that can touch lifestyle, that can mitigate your risk, lower your risk percentage like lifestyle can do. And that doesn't even include getting your spine checked weekly, or bi-weekly, or monthly, weekly being ideal. That's what I do. You have a clear nervous system, the nerves that are feeding the heart, the cardiovascular system, the arterial flow. That's a very important thing, not included here, but you probably tack on, I don't know, let's be conservative, probably bump it up to 90%, who knows? But nothing can beat lifestyle. No drug, no combination of medications. Regular sauna use in heart health. How many of you guys are into sauna? Use sauna intermittently, regularly? Yep, fantastic. So that's something that is fully integrated into my week. I do it every single week. Did it this morning for an hour. Studies have shown that frequent sauna bathing, I have a far infrared here and also at home. 50% lower risk for fatal heart disease, 51% lower risk for stroke, 46% lower risk for high blood pressure. Look at those numbers, guys. That's one thing. You don't like getting heated up. You don't have to do sauna, but that's one more thing you could add and stack to the strategy. Or you could just, maybe not buy a sauna, just spend a lot of time outside in July, August, September in Central Florida. You got your built-in sauna. 4 to 7 times per week, 20, 25 minutes, 30 minutes. I average twice per week, 2 hours per week, and I feel great. Get super hydrated, mineralized before and after. So here's the big deal, the CRP, the inflammatory marker. This is really the bullseye to focus on and shoot at. Not cholesterol, but inflammation or inflammatory levels in the body. There are a lot of markers, there are a lot of ways to measure inflammation. CRP has the most research behind it. 22,000 person study, male physicians. First large study to show that elevated C-reactive protein. C-reactive protein, a protein made by the liver, it is a surrogate marker for the level of inflammation systemically and cardiovascularly. That's what it is, inflammatory marker. First large study to show that elevated levels of CRP over 1, medically they want you under 3, but you really want to be 1 or under. You're associated with a 3-fold increased risk of what? So do you want to know your CRP? Doctors hardly ever include it on your panel. Hardly ever. In here, as a new patient, we do a vitamin D CRP on every new patient comes through the door. If you haven't had it yet, we've got you on the radar to do that for you. In the Harvard's Women's Health Study, CRP was the strongest predictor of risk for cardiovascular event. Women in the group with the highest CRP levels were more than 4 times or 400% as likely to have died from coronary disease or suffered a non-fatal heart attack or stroke. So CRP is very important. Now, one of the things you're going to see in the Jupiter study, when I show you in a moment, in the study, statins have an anti-inflammatory effect. If you bring inflammation down, cholesterol, triglycerides, a lot of things fall, HDL goes up. So it has an anti-inflammatory effect, and it will lower CRP. The problem is there are other inflammatory markers in the body that go up because you tricked that HMG-CoA reductase and all these other bad things happen. And that's why diabetes, kidney disease, and all these other things happen. But the drug companies are only looking at LDL fell, CRP fell, and they're myopic. They're looking through this little tiny lens at this, but not at the whole person and not what's going to happen a year, 5 years, 10 years, 15 years down the line. And if it does happen or something does go wrong, your doctor is not going to know where it came from. They're not going to put 2 and 2 together. Why? They're getting their knowledge from the pharmaceutical companies. So again, we know it's important. Here's the Jupiter study. This is a study done by the makers of rosuvastatin. Big, big study, a lot of people. Patients with low inflammatory levels had fewer heart attacks no matter what their LDL level was. They stopped this study after 1.9 years because, like I mentioned earlier, there was a 27% increase in diabetes cases out of the group. And if it would have continued, there would have been a lot more problems as well. They got the data they needed. They mined it out. They published absolute or relative benefit. What do you think? Relative benefit. And they published, this is their own study in 17,000 people. This is, you'll see it in your notes. You'll have it in the slides. So again, the medications do have an effect in the body. But the problem is all those other things that are going to happen eventually. Here's another study, LDL, leave LDL alone. Leave total cholesterol alone. This study right here, one of the newest studies that came out, LDL cholesterol that is too low is associated with higher deaths from infection and cancer. Why? LDL it's an arm or a branch of the immune system. When you have inflammation in your arteries, LDL comes to patch up and repair and heal the damaged areas in your arterial system. So you don't want to monkey with it. You don't want to bring it down. The brain needs what? A lot of LDL. So 139 conferred the longest life expectancy in this study. The people bringing their panels in here, oh my gosh, my doctor circled this in red, highlighted it. I got a 259 total cholesterol level. My LDL is at 180. Freaking me out. They come in shaking. And that bothers me. When a patient comes in here and a doctor does that to them and they're all shook up, because you want to know why? That goes down to a cellular level. That's not healing. That's not going to help you heal. Your mind now is creating disease as you're getting an anxiety attack and panic attack. That's what medicine does, whether intentionally or unintentionally. So 139. I will show you in a moment how to read your panel and how to challenge your cardiologist, how to challenge your PCP. Well, one of the things that they're leaving out is what? Is your spine important? Is chiropractic important? If you want a healthy heart, I don't care what you say, whether you believe it or not. It's not chiropractic. It's not in my opinion. If the structure is like that, are you healthy or are you sick? Can you have a healthy heart walking around like that? You tell me why not. Yeah, it's like common sense. Chiropractic's so simple that sometimes people can't even get it. Like some of you guys, literally, including me, you bang your heads against the wall trying to explain why you get adjusted weekly or every couple of weeks, right? People can't understand it. And in your mind, you're thinking, why can you not get that? Forget the word chiropractic. If the spine is like this, a bone's out of alignment right here, these nerves, the atlas is out of alignment, subluxated, the nerves right here can get irritated, inflamed, and those nerves go right into the heart. The heart doesn't control itself. The nerves control the heart. By the way, the best time to get adjusted or take care of your spine is when you have a heart problem or when you don't have a heart problem. When you don't, right? You want to keep things running. That's the best time to get adjusted. When you don't have a crisis, but look what's going on here. There's the vagus coming off the medulla, comes off the brainstem, loops over the atlas vertebrae, and where does it go? It goes right into the pacemaker, the SA node of the heart. That's the pacemaker. We're all born with a pacemaker. We have that right here. And the pacemaker controls the rhythmic flow of electrical current through all four chambers of the heart. The vagus nerve coming off the top of your neck controls that. So is it important to have chiropractic care for your spine? For the upper part of your spine? Yes. You don't have to have neck or back pain to benefit from chiropractic. Everybody needs to have clear communication coming through here, and that's what's happening there. And then C1, 2, and 3 going into the atria, the atrium of the heart, controlling the valves, the bicuspid, the tricuspid, the mitral valve. So you can see right here, the upper part of the back controls the ventricles that push blood up into the lungs to get oxygenated and then out through the aorta, pushing oxygenated blood into the body. All of that's controlled through the nervous system right here. The heart doesn't do that on its own. Medically, legally, if they want to determine in the hospital someone's dead, legally dead, what do they check? Heart waves? Yeah, they check the neurology, because that's what's controlling everything, including the heart. The heart can come out of your body, sit in a cooler of ice for an hour in a saline solution. Stopped. They can put it back in, rig it back up, wire it back up, and shock it right back into working. This stuff stops, you're in trouble. You're not coming back. The heart, no. So you guys can see the wiring there. So this is a non-negotiable. If you want a healthy heart, you can't leave the spine out of the picture. And that's not why you would want to refer somebody here necessarily. Oh, you got high blood pressure? Go there. They'll take care of your spine. Your blood pressure will come down. No, I mean, the theme of it all is this. Everybody deserves to have open nerve channels. Everybody deserves to have a brain that can communicate with their body, because it's going to give you the best chance at being healthy and strong, right? That's why you should never give up on your loved ones, the loved ones who are not sitting here with you. your spouses, your kids, your grandkids. John and I were talking about that earlier. One of the most persistent chiropractic warriors in the house. It amazes me. Like, he never gives up on people. Every time he's here, he's like, got this person I'm talking to, and I'm this person. And like, they must have said no like 50 times. And he won't give up because he wants them to receive the life-giving benefits of chiropractic care. Everywhere you go, tell people about it. Not your job to necessarily get them here. Plant the seeds. Why is it important? Because they don't know. People don't. You think people know this? Like, to us, we're sitting here, most of us are saying, like, I knew that. I saw the chart in your room last time I got adjusted. Right? Some of you got Michelle, 20 years, been coming. It's like, yeah, I've seen that before, Dr. Dan. You can move on to the next slide. Right? But the community doesn't know this. You guys know that, right? They have no idea that this controls everything. A patient came in earlier. She was at the hospital yesterday. Thought she was having a heart attack. Kind of intermittent, not really coming regularly, and just all over the map with her visits. So I was a little easy on her, but she's like, I was at the hospital yesterday. I thought I was having a heart attack. I had this pain. You know what they did after they checked her out? They said, you have a chiropractor? Because you have a pinched nerve, you need to go see your chiropractor. Yeah, they told her that. I'm not making that up. They told her that at the emergency room. I was like, wow. I was like, okay, that's neat. That's good. So I'm glad you're here. And now that you're here, get regular with your schedule. I wasn't trying to kick her while she was down, but like, stay on your schedule. It's great to see you this year. I'll see you in 2026. No. It's like, get regular so you don't land in the emergency room, maybe, right? So here's the heart rate variability. In our office, what we do, the three-finger study, it's looking at the gas pedal. You guys already know this. Yellow nerves are the gas pedal, the green nerves are the brake. Okay, yellow nerves speed up the heart, contract stronger. The green nerves, if you could see those, relax the heart and it pumps easier. And so what we want to do is we want to keep balance between gas pedal and brake. That's what we're trying to achieve. This is the fight or flight side of the equation. This is the relaxatory side. We want to achieve balance. When the nerve system is at balance, the heart works better. You have a better level of resiliency. You can adapt to stressors more readily, better, in a healthier way. You guys, many of you guys have heard me use this analogy. I use it quite often. If you're driving down I-4, someone runs you off the road, your blood pressure, everything's going to go up. You should react very strongly. But if you're an hour down the road and the gas pedal's still pinned down and the brake hasn't chilled things out and recalibrated the system, now you got a problem. And a lot of people literally get pinned in one pedal or the other, usually the fight or flight. And they live there. And that's a problem because a lot of bad things happen. This is an inflammatory state. The heart stays contracted. The heart stays at higher level. It can increase, electrically, it can increase blood pressure. So again, that's why it's a huge part of the puzzle. So HRV, that's what this is, an HRV study. It allows us to see what we can't feel. It makes the invisible visible. It may actually be one of the most important biomarkers of heart health outside of blood markers. In order for you to have a heart attack, you must experience both a drastic decrease in brake and an increase in gas pedal. 75% of heart attacks are triggered by the autonomic nervous system with physical, emotional, chemical stress hitting the system. And because the gas pedal and brake are not working, the neurology is not working in a balanced way, the gas pedal just goes crazy, fight or flight goes crazy, the heart can't settle down, you have a heart attack, an electrically based heart attack. So again, very important to be able to have lifestyle strategies to deal with stressors, physical, emotional, chemical stressors. What are some of the things we can do to reduce, like how do you get this to here? From a physical standpoint, what are some of the things you can do? Exercise, walk, meditate for the emotional part, right? Physical, emotional, or trauma, thoughts, toxins, as we always talk about, right? What is another way you can remove structural stress off the nervous system? Get adjusted, home care, Denerol, Stroops. No stinging thinking. Prayer, meditation for the emotional part. How about chemically? Three things that can radically influence us and create balance through neurology. Green tea, how about that? Omega oils, O3. Curcumin has an effect, a strong neurological balancing effect on this system. So again, there's so many things that we can do. Grounding, getting out, fresh air, sunshine. So many things that we can do to exert balance. Hydration, the amount of sleep you're getting. So many things affect it. So again, we have ways of monitoring. The heart rate variability is not a plumbing quantification. It's an electrical thing that we're looking at, right? And it's very accurate as to how balanced not just the heart electrical information is, but just overall neurological function and balance in the body. Isn't that a cool thing to have done regularly? We do them every 12 visits in our office. And we want to see, say from the physical standpoint, how is the adjustment impacting the structure? Is it getting it healthier? If it is, then that healthier structure should have a healthy effect on the function running through it. This is one of the ways that we measure it, one of the diagnostics. The adjustment should be helping in creating more balance. One of the things, not the only thing, but one of the most important things. So this is a joke too. Back in 1984, I looked at that. That's Walter Mondale when he was running for president or vice president or whatever it was. Cholesterol. Now the bad news, don't eat the egg yolks. That's where all the nutrition is, by the way. Just give me egg whites. You're missing all the nutrition, right? So they said, get away from this stuff, bad. But then Time said, no, we made a mistake. It's good. Eat butter, eat fat. Then they said inflammation is the issue. So they got it right finally. They did studies showing that saturated fat does not clog the arteries. It's the inflammatory levels. And I'll explain that in just a moment as we move through the information. Are you guys learning tonight? You glad you came? And many people have been to multiple heart master classes, and you've come back over and over and over. Why? You learn more, right? There's so much. It's like drinking out of a fire hydrant. But here's how it works, and here's how inflammation affects the arteries and why you get clogging. So think of it this way. If I kept coming along here and I kept nicking my arm, okay, first it's gonna bleed, it's gonna clot, right? And I'm gonna have a scab. Then eventually the scab will fall off. If I scratch the scab enough, it's gonna mess the skin up, right? Okay, so it's healed up. And then I come back around and I do it again. It rips it open, rips the scar area open. What's gonna happen then? Same thing, right? It's gonna bleed. And okay, so now I've done that 1,000 times. What is that gonna look like? You're gonna have a lot of scar tissue on top of scar tissue. Yes? So in the arteries, what happens is, whether it's the primary dietarily wise, it's too much refined sugar, rancid oxidized vegetable oils, omega-6, those two primarily, if you're smoking or a lot of alcohol, or there are a lot of different things, heavy metals, different things that are floating through the bloodstream are like nicking. It's like nicking the elbow here or the arm. That's what it's doing to the intima or the internal lining of the artery. Does that make sense? Now LDL it's like basically like a fire extinguisher. It's an anti-inflammatory, and it's trying to put out the fire. But what happens over time is the LDL starts accumulating like the scar tissue. So when the doctors open up the arteries, they just see a bunch of cholesterol there and say cholesterol causes heart disease. But it's not. It's the inflammatory process that keeps happening over and over that causes more and more LDL. And then as that stuff's going on, stuff that's floating through the bloodstream is now starting to agglutinate to stick to that area. Maybe there's bacteria, viruses, salts, microbes, whatever else is in the bloodstream. It starts sticking to that place, and then as time goes on, it occludes. It gets thicker and thicker and thicker if the lifestyle doesn't change. If the lifestyle change, that can be reversed. The body will reverse that. That's been proven in scientific studies, with the right dietary changes and otherwise. So again, does that make sense? That's the simplest explanation. The inflammatory process, it's inflamed. The LDL cholesterol is going there to patch up the damage. But if it goes there often enough, it's going to build up, like the scar tissue building up, and then you have a problem. So again, the injury and inflammation to our cells and blood vessels is caused by what? High refined carbohydrate, high seed oils recommended for years. Dietary primarily. Now you have an atlas subluxation messing with the vagus nerve, and that's not only messing with the heart, but that vagus nerve, by the way, dives into the body, breaks up into a trillion different filaments, and goes into every single vessel in the body. So if the atlas bone's out of alignment and it's irritating the vagus gets kind of disconnected in a way. And if you take the brake out of the equation, the accelerator takes over. It speeds the heart up, it speeds flow up, it causes even more problems because as you speed the blood pressure or the flow of the blood, it causes more abrasiveness to the arteries. High blood pressure and the pump going hard all the time wears out the internal part of the arteries. So again, these are all the things that can do it. They thicken up. You eat a lot of sugar. Insulin goes up. Insulin is a growth hormone. Insulin thickens up the internal lining. This is what we mean by refined foods. All the sugar, right? Trans fats, hydrogenated fats. Fats that are hydrogenated so they have better shelf life and they sit there longer, but when they go into your body, it doesn't help you. Okay? It actually causes more inflammation, more clogging. Reduce and eliminate sugars, hydrogenated oils, rancid vegetables, and trans fats. This is not a game of perfect, by the way. Just so you know, to have good heart health, you don't have to eliminate all of it. If you or I eat out at a restaurant, good luck with that. Okay, I like when I go out, I get it out of my mind. I just don't even think about it anymore. Just going to enjoy my meal. So that enjoyment will offset it's like I pray over the food, enjoy the meal, and it has a lot of health-giving benefits that neutralize the bad stuff. In a restaurant, they're cooking with rancid oils. They're not ordering primo oil for you. Like, Pastor Williams is on the way. Let's get like the primo olive oil because that's all he'll eat. It's like, no, you're getting the stuff that's been cut with canola oil and all the bad, nasty, soy oils and all that stuff. So again, just know that you got it on the radar. You know that eating meals at home are going to really help you navigate around this stuff and avoid it. And these are the things that really are heart healthy. They make the arteries more flexible. They make sure that things are not sticking. They make the arteries slicker. They really help protect the arteries. So what you have here, EPA, and I'll tell you this now, I'm going to get to it in a moment, but I'll give you a preview. There are 3 things that actually protect the internal lining of the arteries and also the LDL from getting messed up in the artery and lodging the artery. CoQ10, fish oil, and resveratrol, from red wine, you can get it. Okay? So think about this for a moment. CoQ10 protects the arteries from getting clogged and the LDL from sticking and moving into the vessel and blocking up the vessel. It's the very thing that your statin medication shuts down. So when you're taking the medications, it actually accelerates the arteries clogging. Also, the other marker I'm going to show you on the panel in a moment is LPA and apoB, which are the most dangerous forms of LDL, which the medications don't touch. They actually make them go up. If you have been given a high calcium artery score, the doctor said, anybody here ever have one of those calcium artery? They'll tell you, it's at 200, 300, 400, you're at 800, you definitely have to be on a statin. The doctor doesn't give you that statin, tie you down and force it down your mouth before you leave the office. They'll go to jail. They got to give you a statin. Did you know that it does not stop the accumulation of calcium in your arteries? In fact, what I've seen clinically, what I've witnessed, it actually accelerates it. It makes it worse. And you guys already know why. You've seen the biochemical pathways. I didn't make that slide up. You guys saw it. That's in the medical literature. So you have polyunsaturated good oils in here. You got the good fats, the saturated fats in the egg yolk. A great brand of extra virgin olive oil. The green tea helps break up and remove plaques and make the arteries supple and flexible. This is the nitric oxide or the arginine, helps the vessel stay open and dilated. That's what these 2 supplements, EPA, the fish oil, monounsaturated fats, and the avocados. Avocados are great heart food. Coconut oil, almonds, walnuts. The great omega-3 oils, the fats in the salmon, sardines, mackerel, anchovies, salmon, herring, pickled herring. Anybody? Yeah. Talk to Dr. Leif about that. The Swedes, they go crazy over that stuff. Right? So this stuff right here heals the arteries, repairs the arteries, keeps your arteries healthy, keeps your brain super healthy, especially sardines. So all these are artery, it's not just brain food, it's artery food. So again, I'd eat more sardines, but my wife refuses to allow me to open up the cans in the house. So this is all Mediterranean, polyphenols, antioxidants in the fruits and the vegetables. Red meat, you got a lot of important things. Carnitine, taurine, a lot of great amino acids in grass-fed red meat. Feeds the heart. Really good for your body. Really good for your heart. Minerals, sea salt. If you want a healthy heart, you need a lot of salt. Mineral salt. The pink salt has all of the elemental minerals combined. You go to a restaurant, the white salt shaker, sodium chloride. Many of you guys, I've talked to you about this. The sodium chloride is poison because it's isolated from the mineral salts. It's isolated from all the other minerals. So your body sees it as an isolate or a poison, and the blood pressure goes up because it's a poison to the heart. So it's got to raise the blood pressure to respond. So you want a lot of salt. When I go home to eat dinner later, I dust my meal. Tons of salt on my meals. The pink salt, which we have in the back here. Really important. For you guys who are under active corrective chiropractic care, doing the rehab here, where your visits are more intensive than a maintenance patient, you need to make sure that you're drinking a lot and you're also taking pinches of this stuff and throwing in your water, or you do the elements, electrolytes back there. So you want a lot of salt. Really, really important. I'm going to explain this to you. With omega-3, it's the exact opposite of a hemoglobin A1C. The lower your hemoglobin A1C, the better your blood sugar management. You want like a 5, 4.5. But the opposite for omega-3, when we do an omega-3 index, we want your omega-3 to be between 8 and 12% of the cell membrane of the red blood cell to be made up of fish oil, DHA and EPA. That's why we do the blood spot in here. We want to know what your omega-3 index is. And most people come in at 2, 3, 4, and we need to double that. We have a calculator that we plug your number into, and we figure out the exact dosage that you need to get to the optimal range. And then once you're there, we figure out what your maintenance dosage is so you don't waste money on fish oil. The other thing too, I have a lot of patients who shop garbage fish oil, and they're spending money, and they think they're getting a deal because they get cheap fish oil. And we do their blood marker, and their fish oil, their omega-3 is at 2. They're like, well, that's not true, that number. I take fish oil every day. I said, well, the one you're taking ain't working. Yeah, that's your blood marker right there. The most expensive supplement that you can take is the one that doesn't work. I don't care if you buy these or not. Doesn't matter to me. I have them up there because those are the ones I take, and they're quality. You want to go shop at Walmart for your vitamins? Go do it. But when we go to test you and your labs look awful and you have a crate of supplements and you're spending $500 a month on, that's expensive. That's really expensive. These supplements here are 2, 3, 4, 5 times more than you will find at Costco, Sam's, or Walmart, or Target. Do you want to know why? Because it costs money to make quality supplements. That's right. It costs me more money. I got to buy those for my own body. I get a pack every month. It's a little pricey. But you know what? Why would I not want to put quality in my body if I'm doing it every single day? Does that make sense? Right? So yeah, we already know that. We know that those are a little bit more than you can get elsewhere, but you're getting quality. And I know it because I look at patients' labs all the time, and their numbers are just way off, whereas they're taking supplements every day. They shouldn't be that way. They're completely nutrient deficient when they're not getting quality. So what this is showing, by the way, the risk of the acute coronary syndromes, heart attack, stroke, whatever, it plummets. Your odds ratio, the odds of you having a cardiac event plummet as you go to the ideal optimal place of your omega index. Super easy to test, right? Many of us have had this test in here. It's a blood spot. It takes Jeanette, she gets great pleasure out of sticking your finger and watching the blood come out. I don't know, she's a little morbid. She's like, oh yeah, you're gonna do one of those today? Oh yeah, come right this way. We're going to my special room over here. I'm gonna draw some blood out of you. Write on a card, boom, mail it out, go out the back door, throw it in the mailbox, and in a week we know what your number is. So here's where we finish on understanding the numbers, how to interpret them, how to actually formulate the ratios, and how to have an intelligent conversation with your physician, your medical physician. I know for many of you guys, you say to me, no, you're my doctor. I get that. But most people have a team. Most of you guys have medical doctors, cardiologists. That's fine, right? Whether it's just me or others, just understand when I have a conversation with you as well, I want you to know what these things mean. And the more knowledge you have, the less you can be frightened. We take fear, life without fear, where knowledge replaces that fear. You see? Because that anxiety alone can produce disease. So the general panel, comprehensive metabolic panel with immune system, complete blood count. Inside of that, you can actually get total cholesterol, triglycerides, HDL, LDL. The only thing of value in your general panel is triglycerides on your blood lipid panel. That's it, unless you have the ratio. So what you want to do is you want to create a ratio. So most of the time it's created for you. Total cholesterol over HDL under 5, equal to 5 or under. Small, dense LDL under 20. The small, dense are the ones that cause the big problems because when they're trying to protect the arteries, they're so small they can get lodged in to the wall of the artery. They can get through the tennis net. Those are the ones that need to be measured. Small, dense, but they're never measured. C-reactive protein under 1, inflammatory marker. Another inflammatory marker, homocysteine under 8. That goes up when you are B6, B9, and B12 deficient. It's a signal that you need to, and a lot of people say, well, that doesn't make any sense to me, Dr. Yachter. I take a B complex every day. I take it until my P glows. You know, it glows in the dark. It's yellow, and I've been taking it for years. But yeah, your homocysteine's at 17, which actually increases your risk of having a stroke by 200%. So clearly there's a deficiency there because the only time that number goes up is with a B6, 9, primarily B12 deficiency. A1C under 5.5 is ideal. LPA, that is your risk for clotting, having a thrombus and embolus, you want under 30. ApoA1, that takes the plaque off your arteries. ApoB, you want under 90. This is the leading indicator in the medical research for your risk of having a heart attack or stroke, never measured. You want to know what that apoB is, and you want to get it under 90. There's a ratio that we create as well. apoB over apoA under 0.9. Vitamin D, if you're vitamin D deficient, 15, 20, should be between 80 or 100, 600% more likely to have a heart attack. This right here is for the rupture-prone plaque. That can actually measure how likely the plaque that's in the arteries is to rupture and go into your bloodstream. There's actually a measurement for it. We measure that marker. And there's the omega-3 index. So what you want to do at first, when you get your panel back, you want to look at 3 ratios. I don't care if your total cholesterol level is at 500. Doesn't matter until you do these ratios. Total cholesterol over HDL, LDL over HDL, which you want under 3, and triglycerides over HDL, which you want under 2 to be optimized. You do those ratios. Many of you guys heard me mention this, certainly if you're here in September for the heart masterclass. Doctor tells you need a cholesterol medication. You slip it across the desk, say, well, I went on Dr. Google, and I learned that these ratios, don't ever say my name because I'm not trying to make enemies if I don't have to. And you say, I saw these ratios, these 3 ratios are really important. Do they mean anything to you? I mean, should they be a part of my health plan? And I see that they're really low. Do I still need the medication? The doctor will back off 100% of the time if those ratios are right. They're like, maybe we can wait a little longer before we put you on the medication. That happens almost every single time. And do it in a loving, respectful way. That's all. Just have it, a nice casual conversation, but say, here's what I've learned. I just want to understand your perspective on it. And after you get their perspective, do you really feel I need the medication? And so they're going to know that they're working with a well-informed, well-educated healthcare consumer. And they're going to treat you differently. They're going to treat you very, very differently. When they see you coming and they have you on their schedule, it's fine. It's no problem. It's not a problem having a relationship with your medical doctor. It's just that they need to know who they're dealing with. And they need to know that you're armed. You're armed with, you're bringing the receipts with you. When you go to your appointment, they know who you are, and they know you're going to ask questions, and they know they can't pull the wool over your eyes. That's all. That's what that means. So again, you want to know the small dense LDL, the golf balls. Tennis balls are the large, fluffy LDL particles. Small ones are the ones you want to know, because when they go to protect and heal and seal up the arteries, they have a tendency to go through, and they can cause long-term problems, even though that is not the intention of them in the body. If you keep nicking, and the small dents keep going there, they're eventually going to build up. They're going to have a cumulative effect and a blocking effect. More research, the end of it right here, how elevated LPA, statin therapy increases LPA. That's the marker. That increases your likelihood of clotting and blocking the arteries. Myocardial infarction, as that, anybody here ever have an apoB, ApoA, that ratio ever done? Okay. With me? Okay. Right? Doctors don't do it, but you can see there's a linear progression for myocardial infarction, for your heart attack risk. As that number goes over 0.9 and north, you're going to have a problem. So again, that's the inner heart study. Just more on fish oil. Fish oil, large study, 500,000 people, lowers risk of death among patients with previous cardiovascular disease, lower risk of death from major cardiovascular disease. It extends life. It's proven, all the studies. So number one, make sure you always test. Don't guess. Know what your number is so you can dose properly, get up to the right range, and then from there you figure out what your long-term maintenance dosage is going to be. Does that make sense? Oh, by the way, that's the calculator right there. You plug your number in. The calculator tells us exactly how much you need, how much you don't need, so you know exactly how much to take. You guys learning tonight? Good? All right, we've got 1 minute. Now I close it up because you guys got to go home and I got to go home. But these are the big players right here. All of these reduce inflammation, increase HDL, reduce triglycerides, improve the ratios. All the things that we talked about. Make the heart work better. Reducing all of the inflammation in the body without the downstream side effects of everything I showed you earlier regarding the not only cholesterol medications, but the blood pressure medications as well. The fish oil right here lowers triglycerides, prevents blood clot thinners. Right here prevents what? Arrhythmias, atrial fib as well. Resveratrol reduces inflammatory markers. It reduces LDL from becoming damaged when it's going to seal up the arteries. It prevents it from becoming damaged and keeps it smooth and supple and flexible and allows it to move on after it's repaired. Raises HDL. So this is resveratrol without the alcohol, without the red wine. Curcumin reduces inflammation. These are the most researched 5 in terms of heart health, supplement-wise, with no side effects. They don't cut off pathways. Again, these do not take the place of a healthy lifestyle. Get it? Get it? Not a problem augmenting healthy lifestyle. It's a good idea. I have a lot of patients who take it, which I think is really smart. I take a lot of these as well, just about every one of them, as a preventive measure. But again, it doesn't preclude you doing, getting the right amount of sleep, exercising, adjustments. So nitric oxide, that is a vasodilator, helps keep the arteries nice and supple and open. And CoQ10 shields the small LDL from being damaged. CoQ10, resveratrol, fish oil shield those molecules of LDL from becoming damaged and building up and plaquing and clogging the arteries up. And it does all these other incredible things. Again, without blowing up your pathways. So guys, I love and appreciate you. Thank you for being here. And if you I appreciate it. Get your panels, get your supplements, and everybody have a great night.